We are still at Kloud Health Media, whereby we talk health. We talk about health-related issues. Now, Dr. Byamugisha, yes, we have always heard of a diabetic foot. How does it come about that Kamsime is diabetic and it has ended into the leg up to the level of being amputated?
Yes.
How does it come about?
Thank you very much for hosting me once again. My name is Dr. Asaph Byamugisha. I am a medical doctor and I work with Doctors Case Medicals. We are discussing diabetes, and one of the complications of diabetes is what we call the diabetic foot. The diabetic foot comes through two mechanisms. One is diabetic patients usually have what we call neuropathies, the nerves that take sensation, that take pain into lower limbs or extremities, sometimes are not functioning well, especially patients who have uncontrolled diabetes. So you find a diabetic patient does not feel pain in their limbs. So that is one of the problems. Another problem with the diabetes, especially uncontrolled diabetes, is that high blood sugar in blood sometimes damages the vessels that take blood.
Okay.
So you find your extremities, your limbs, your feet, your hands are not getting enough blood, are not getting good blood. And that is also dangerous. So because of our normal activities as people,
yes,
once in a while you get a cut on your foot, or you're moving, you stumble on a stone and you get an injury, or you are walking in your garden and you're punctured, or you're cut by maybe a stone or a metal that could have been lying in your garden or in your compound.
Or the garden tools that we use.
Sometimes exactly, you're digging and you cut yourself. So it is unavoidable that you get a wound. So diabetic patients, when they get wounds, because they don't feel pain, because blood does not reach the extremities or these limbs very well, sometimes their wounds become complicated. You find a wound has started on a very small toe, then it now affects the bone deep down. It continues spreading and affects the entire foot. And if it is not attended to urgently, you find the entire limb is infected or is rotting because of the bacteria that have entered through that wound.
Yes.
So you find patients of diabetes now getting amputated, or their limbs are cut off as a way of treating them. And the research shows that 60% of patients whose legs are amputated are as a result of diabetes. It is by far the biggest reason why patients lose their limbs, what we call amputation. So the simple advice to patients who are diabetic, in order to avoid getting wounds on your feet, I advise diabetic patients, one, make sure that your sugars are controlled. Make sure that you're on the proper treatment, you're seeing a qualified health worker, and your sugars are controlled. Because having uncontrolled sugars now predisposes you to killing your nerves and your blood vessels. So you find that when you get wounds, they don't heal soon enough or in the time as usual. Okay. Another advice that I advise, of course, people is avoid barefoot walking. It is common, you find people in villages or in towns, they are walking on foot without anything. So I advise diabetic patients, always have something in your feet. When you are walking, you be putting on sandals, you be putting on shoes. When you're in your garden, kindly have shoes or have gumboots to avoid cutting yourself, to avoid stones injuring you. That is number 2. Number 3, make sure that every day you take good care of your feet. You wash them. You have been in a garden the entire day. When you don't wash your feet, there is going to be dirt that maybe piles up between digits, in toes, and when you don't clean them, you might end up getting infections in your feet, and these now can turn into wounds, and if not attended to, you find you're losing a limb.
Yeah.
Another simple advice, of course, is make sure that you examine your feet every day. If you can't bend enough to see every aspect of your foot, let someone help you. They examine to see if there is any wound that maybe you're not sensing, because you naturally, as a diabetic patient, sometimes you don't feel pain. So if there is a wound that maybe you don't know, that person will help you identify it, and you go to get professional health care.
Yeah, as we draw closer to the conclusion of the risk factors, especially for the people who are at the risk of contracting diabetes, I want you to give some final message to our viewers so that they can keep healthy lives that are free from diabetes.
Thank you very much. My simple advice to people is, especially in order to prevent diabetes, I would like that we live consciously. We eat right, we become active, we do exercises, we avoid gaining a lot of weight, we avoid being overweight, thereby reducing risk factors of getting diabetes. And patients who are diabetic, my simple advice is make sure that you get professional health care to control your sugars, because when you don't control your sugars, then you are predisposing your body to a lot more complications that can come from uncontrolled diabetes.
Your name once again?
I am Dr. Asaph Byamugisha, and I am a medical doctor from Doctor's Case Medicals.
Thank you very much, Dr. Byamugisha, for taking us through that topic, especially of the risk factors of people at the risk of getting diabetes and the diabetic foot. I must say thank you for sparing your time to talk to the viewers of Kloud Health Media so that they can get to know how to live better lives. Thank you.